And if you're ingesting collagen, you're taking the supplements or anything, are there any contraindications or an amount you should not go over where it makes no sense?
Okay, so that's a good question. So the only, let's say, potential downside to higher doses of collagen, and that when I say that's really around 20 grams of collagen or more, is that there will be a significant increase in what's called urinary oxalate. Okay. And everyone gets freaked out. Anytime anything increases oxalate in the body, people will just instantly demonize it. But you can't just look at urinary oxalate. Is it doing something else in the urine that would prevent oxalate crystals from forming? And it turns out that glycine increases citrate in the urine as well. And so when they give glycine to animals, it prevents urinary calcium oxalate crystals from forming, even though there's an increase in urinary oxalate. So there is a theoretical increased risk of, let's say, kidney stones when you start consuming 20 grams of collagen or more. It's really not at 10 grams. It's a very minimal. But when you start consuming 20 or more, you're sort of creeping up to the level that we see occurring in kidney stone formers. That doesn't mean that you're going to form a kidney stone, because now maybe you have more citrate in the urine as well, offsetting that increase because of the glycine in there. But that's something that people do need to be aware of. If you're going to start consuming 20 grams or more, and you are a calcium oxalate former already, be wary.
Mm-hmm. Now, we talked about the foods that you can use, such as the bone broth, anything that's gelatinous to increase collagen. But what about things that deplete? Are there diets, low protein diet, let's say, that are going to put you in a depleted state of collagen?
So coffee is something that will deplete glycine, because the chlorogenic acid in coffee, half of that forms the benzoic acid, and then benzoic acid combines with glycine to form hippuric acid, and then you excrete the glycine as hippuric acid. So for every 7-ounce cup of coffee, you are excreting 100 milligrams of glycine just from the benzoic acid pathway. Now we know that also, coffee is great, but coffee does reduce the absorption of almost everything. Like almost every mineral or vitamin does get somewhat lowered when you consume coffee. Coffee is great, but you just got to offset some of these, nutrients that are being excreted or absorbed less because of the coffee. We talked about the benzoic acid that are in processed foods, certain processed lemonades and iced teas and things like that will increase the loss of glycine. Certain mayonnaises as well will contain that. Certain foods too, cinnamon, but most people aren't using enough for it to really matter, that will form benzoic acid. But really it's the inflammation, it's the activity level that starts really increasing your need for glycine, because there's twofold. Your need for glutathione grows up dramatically when you have higher amounts of inflammation, because glutathione is the master antioxidant. And glycine is a rate-limiting amino acid in the formation of glutathione. So cysteine is the first one, but if cysteine levels are good, then it comes down to glycine as a rate-limiting amino acid in its formation. And then also, inflammatory proteins like C-reactive protein are actually literally built out of glycine. So when you start producing more inflammatory proteins, your need for glycine increases. And then just an increase in body mass, an increase in activity level, an increase in, let's say, sun exposure will all increase your need for collagen.